The skin is one of the largest and most visible organs in the human body, and it often reflects internal health conditions long before other symptoms become obvious. One of the earliest signs of a slowing thyroid can appear directly on the skin. Many people assume that dry skin is simply the result of aging, weather changes, dehydration, or the use of harsh soaps. While those factors can certainly contribute, persistent dryness that seems resistant to normal skincare routines may indicate something deeper occurring inside the body. The thyroid gland produces hormones that help regulate metabolism and influence nearly every cell in the body. These hormones play a crucial role in maintaining healthy skin by supporting cell renewal, circulation, and moisture balance. When thyroid hormone production decreases, the skin's natural processes begin to slow. New skin cells are produced at a reduced rate, dead skin cells accumulate more quickly, and the skin gradually loses its healthy glow. Many individuals with low thyroid function notice that their skin feels rougher than it once did. Areas such as the elbows, knees, lower legs, and hands often become especially dry. The skin may appear flaky, cracked, or dull regardless of how much moisturizer is applied. Some people describe the sensation as if their skin is constantly thirsty and unable to retain hydration. Reduced thyroid activity also affects the body's sweat glands. Healthy sweat production helps maintain skin moisture and flexibility. When sweat gland activity decreases, the skin loses one of its natural mechanisms for staying soft and hydrated. This can leave the surface feeling tight, uncomfortable, and unusually sensitive. Another visible clue involves changes in skin color and texture. Poor circulation associated with low thyroid function can cause the skin to appear pale or less vibrant than usual. Some individuals notice a yellowish tint developing, particularly on the palms of the hands or soles of the feet. This occurs because the body processes certain pigments less efficiently when metabolism slows. The skin may also become thicker in certain areas. Rather than appearing smooth and supple, it can take on a coarse texture that is easily noticeable when touched. Fine lines may appear more pronounced because dry skin lacks the moisture necessary to maintain elasticity. Even people who have followed the same skincare routine for years may suddenly find that their products no longer provide the same results. Cold weather often makes these symptoms more obvious. Because thyroid hormones help regulate body temperature, people with low thyroid function frequently feel colder than those around them. Reduced circulation and lower heat production can worsen skin dryness during colder months, creating a cycle that becomes increasingly noticeable. What makes this sign particularly important is that it often develops gradually. The changes occur so slowly that many people adapt to them without realizing how different their skin has become. They may spend months or even years treating the symptom itself while remaining unaware of the underlying cause. As thyroid function continues to decline, these visible changes often become more pronounced and may be accompanied by additional clues elsewhere in the body. Hair and eyebrows can provide surprisingly valuable clues about thyroid health. While many people focus on symptoms such as fatigue, weight gain, or feeling cold, visible changes in hair often appear much earlier. Because hair follicles are highly sensitive to hormonal changes, even a slight decline in thyroid function can affect the way hair grows, feels, and maintains its strength. The thyroid gland produces hormones that influence the growth cycle of every hair follicle in the body. Under normal conditions, hair continuously moves through phases of growth, rest, and renewal. When thyroid hormone levels decrease, this cycle becomes disrupted. Hair may spend less time actively growing and more time resting, leading to gradual thinning and increased shedding. One of the first things many people notice is that their hair no longer feels the same. It may become dry, coarse, brittle, or difficult to manage. Hair that was once smooth and healthy may begin to lose its shine. Some individuals find that their hair tangles more easily or breaks with minimal brushing. Others notice that their hairstyle no longer holds the way it once did, because the texture has changed significantly. Hair thinning associated with thyroid dysfunction usually develops slowly. Rather than seeing sudden bald patches, people often observe a gradual reduction in volume. The ponytail becomes thinner. The scalp becomes more visible under bright lighting. The amount of hair left in the shower drain or on a hairbrush steadily increases over time. Unlike certain forms of hair loss that affect specific areas of the scalp, thyroid-related thinning often occurs more evenly across the entire head. This diffuse pattern can make the problem difficult to recognize at first. Many individuals simply assume their hair is changing because of age, stress, or genetics. Perhaps one of the most distinctive visible signs linked to low thyroid function involves the eyebrows. Medical professionals have recognized this clue for decades. The outer third of the eyebrows, the section closest to the temples, may gradually become thinner or disappear altogether. This pattern is considered one of the classic physical signs of an underactive thyroid. The reason for this unusual eyebrow change is related to the sensitivity of eyebrow follicles to thyroid hormone levels. As hormone production decreases, these follicles struggle to maintain normal growth. The result is a gradual loss of eyebrow density, particularly along the outer edges. Many people overlook this sign because eyebrow thinning can occur for various reasons. Aging, nutritional deficiencies, overplucking, and certain skin conditions can all contribute. However, when thinning of the outer eyebrows appears alongside other symptoms such as dry skin, fatigue, or unexplained weight changes, it becomes a clue worth paying attention to. Eyelashes may also be affected. Some individuals notice that their lashes become thinner, shorter, or more fragile. Although less common than scalp hair or eyebrow changes, it reflects the same underlying disruption in normal hair growth cycles. Another important detail is that thyroid-related hair changes do not always occur rapidly. In fact, the process can take months or even years to become obvious. Hair grows slowly, which means the effects of reduced thyroid hormone production often accumulate gradually. A person may compare recent photographs with older ones and suddenly realize how much their hair volume has changed over time. The quality of newly growing hair can also be affected. Even when hair continues to grow, it may emerge finer, weaker, and more prone to breakage. This creates the appearance of ongoing hair loss because damaged strands fail to reach their normal length before breaking. Some individuals become frustrated because they invest in expensive shampoos, conditioners, supplements, and cosmetic treatments without seeing significant improvement. While these products may temporarily improve appearance, they cannot fully correct a hormonal imbalance affecting the hair follicles themselves. The eyebrows often tell a similar story. Makeup may help disguise thinning areas, and cosmetic procedures may temporarily restore a fuller appearance, but the underlying cause remains active if thyroid hormone levels continue to decline. Careful observation of these subtle changes can provide valuable insight into what may be happening internally, especially when they occur alongside other visible signs that point toward reduced thyroid function. One of the most overlooked signs of thyroid dysfunction appears directly on the face. Unlike sudden symptoms that demand immediate attention, facial changes associated with a slowing thyroid often develop so gradually that they become part of a person's normal appearance. Friends, family members, and even the individual experiencing them may fail to notice the transformation because it occurs over months or years rather than days or weeks. The thyroid gland influences circulation, fluid balance, metabolism, and the health of tissues throughout the body. When thyroid hormone levels decline, these systems begin to function less efficiently. As a result, subtle changes can start appearing in the face long before a thyroid condition is diagnosed. One of the most common facial signs is puffiness. Many people wake up with mild facial swelling after a poor night's sleep or after consuming salty foods. Thyroid-related puffiness is different because it tends to persist. The face may appear fuller, heavier, or swollen even when a person is well rested and otherwise healthy. This puffiness often develops around the eyes. The eyelids may appear swollen, making the eyes look smaller or more tired than usual. Some individuals notice that photographs begin to look different. Their face seems rounder, and the definition around the cheeks and jawline gradually becomes less pronounced. The reason for this change involves the accumulation of certain substances beneath the skin. Reduced thyroid activity can cause the body to retain fluid and alter the way connective tissues handle moisture. This leads to a characteristic fullness that is often most noticeable in the face and around the eyes. Another visible clue is a dull or expressionless appearance. Healthy thyroid function supports energy production throughout the body, including the muscles responsible for facial expressions. When thyroid hormone levels decline, facial muscles may appear less active. The face can seem tired, less animated, or lacking its usual vitality. People experiencing this change are often told that they look exhausted, stressed, or unwell, even when they feel they are hiding their fatigue effectively. Friends may ask whether they are getting enough sleep because the face communicates a sense of low energy that becomes difficult to conceal. Changes in skin quality contribute to this appearance as well. The facial skin may become dry, rough, and less radiant. A healthy complexion often depends on efficient circulation and regular skin cell renewal, both of which are influenced by thyroid hormones. As these processes slow, the skin can lose some of its natural glow and appear pale or lifeless. The lips may also become dry and prone to cracking. Some individuals notice persistent dryness around the mouth despite using lip balm and moisturizing products. Because the entire body's moisture balance is affected, these changes often accompany dry skin elsewhere. Swelling can sometimes extend beyond the eyelids and cheeks. The area beneath the eyes may become more prominent, creating the appearance of under-eye bags. This can occur even in people who previously had smooth skin in that region. The result is a face that appears constantly fatigued regardless of how much rest a person gets. A slowing thyroid may also subtly affect the jawline and neck. Fluid retention can reduce the sharpness of facial contours. Some individuals describe feeling as though their face looks heavier despite little or no significant weight gain elsewhere. This change may be particularly noticeable when comparing current photographs with images taken several years earlier. The eyes themselves can reveal additional clues. While thyroid-related eye changes are more commonly associated with certain thyroid disorders, people with reduced thyroid function may notice that their eyes appear less bright or alert. Combined with eyelid puffiness and facial swelling, this can create an overall impression of tiredness that persists throughout the day. Many people attempt to address these facial changes through skincare products, cosmetic treatments, or adjustments to their beauty routines. While these approaches may improve appearance temporarily, they often fail to produce lasting results if the underlying issue involves thyroid hormone imbalance. The face frequently reflects internal health, and when thyroid function begins to decline, it often leaves visible evidence that becomes increasingly difficult to ignore. The hands, nails, and voice may not be the first things people associate with thyroid health, yet they often provide some of the most revealing clues. Because thyroid hormones influence metabolism, circulation, tissue repair, muscle function, and nerve activity, a decline in thyroid function can create noticeable changes in these areas. Many of these signs develop gradually, making them easy to overlook until they become difficult to ignore. The hands frequently reveal some of the earliest visible changes. Reduced thyroid activity can lead to fluid retention throughout the body, and the hands are one of the places where this may become apparent. Rings that once fit comfortably may start feeling tight. Fingers can appear slightly swollen, especially in the morning. Some people notice that their hands seem puffier than they used to, even when there has been no significant weight gain. One of the most common reasons people eventually discover they have a thyroid problem is because their body begins to feel noticeably slower. This slowdown often affects energy levels, metabolism, body temperature, and physical performance. Many individuals initially attribute these changes to aging, stress, lack of sleep, or a busy lifestyle. Because the symptoms develop gradually, they can become part of daily life before anyone realizes that the thyroid may be involved. The thyroid gland acts like the body's metabolic control center. It produces hormones that help determine how efficiently cells convert nutrients into energy. Every organ, tissue, and system relies on these hormones to function properly. When thyroid hormone levels decrease, the body's energy production slows, creating effects that can be felt throughout the entire body. Fatigue is often one of the earliest and most frustrating symptoms. Unlike ordinary tiredness that improves after a good night's sleep, thyroid-related fatigue tends to linger. Many people wake up feeling exhausted despite spending enough hours in bed. They may struggle to find motivation for activities they once enjoyed and feel as though their energy reserves never fully recharge. Simple tasks can begin to require more effort. Activities such as climbing stairs, carrying groceries, walking moderate distances, or completing household chores may leave a person feeling unusually drained. The body seems to require more energy to perform tasks that once felt effortless. This persistent fatigue often affects concentration and mental performance as well. People commonly describe feeling mentally sluggish or experiencing what is often called brain fog. They may forget appointments, lose track of conversations, struggle to focus, or have difficulty finding words during everyday discussions. While these cognitive changes are not always visible to others, they contribute significantly to the overall feeling that the body and mind are operating at a slower pace. Weight gain is another frequently discussed sign of reduced thyroid function. Many individuals become frustrated because they gain weight despite maintaining the same eating habits. Some even find that they are exercising regularly yet continue to see the number on the scale increase. This occurs because thyroid hormones play a major role in regulating metabolism. When hormone levels decline, the body burns fewer calories at rest. The rate at which food is converted into usable energy decreases, making it easier to gain weight and more difficult to lose it. Even modest reductions in metabolic activity can produce noticeable changes over time. Fluid retention can contribute to this weight gain as well. Some individuals notice swelling in the face, hands, legs, or feet. The extra weight may not come entirely from increased body fat, but also from the body's tendency to retain fluid when thyroid function is reduced. Another hallmark sign involves sensitivity to cold temperatures. Thyroid hormones help generate body heat by regulating cellular activity. When hormone levels fall, heat production decreases. As a result, many people with low thyroid function constantly feel cold even when others around them are comfortable. They may wear extra layers indoors, seek blankets more frequently, or keep room temperatures higher than family members prefer. Cold hands and feet are particularly common. This symptom can be present year-round, not just during winter months. Physical performance often declines as metabolism slows. Muscles may feel weaker, less responsive, or slower to recover after activity. Some people notice increased stiffness, especially in the morning. Exercise sessions that once felt manageable may become exhausting, and recovery periods may take longer than expected. The digestive system can also reflect this overall slowdown. Because thyroid hormones influence the movement of food through the intestines, reduced thyroid function often leads to slower digestion. Many individuals experience constipation or a feeling that their digestive system is not working as efficiently as before. These changes rarely appear all at once. Instead, they tend to accumulate gradually over months or years. A person may first notice mild fatigue, then increased sensitivity to cold, followed by weight gain and reduced stamina. Because each symptom develops slowly, it can be easy to explain away individual changes without recognizing the larger pattern that connects them. As thyroid activity continues to decline, the body's overall pace becomes increasingly slower, affecting energy production, metabolism, physical strength, and daily functioning in ways that are difficult to ignore. Circulation also plays a major role. Thyroid hormones help regulate body temperature and blood flow. When hormone levels decrease, circulation may slow, causing the hands to feel unusually cold. Many individuals with low thyroid function constantly seek warmer environments because their hands and feet remain cold even when others feel comfortable. The skin on the hands may appear pale, dry, or rough due to reduced blood flow and lower sweat gland activity. Another visible clue involves the nails. Healthy nails require a steady supply of nutrients and proper cellular growth, both of which depend on efficient metabolism. When thyroid function declines, nail growth often slows. Nails may become brittle, weak, and prone to splitting. Some people notice that their nails break more easily than before, or develop ridges that were not previously present. The texture of the nails can change as well. Instead of appearing smooth and strong, they may become thin and fragile. Simple daily activities such as opening containers, typing, or household tasks can lead to cracks and breakage. Despite using nail strengthening products, improvements may be limited because the underlying issue originates within the body's hormonal system. The cuticles may become dry and damaged. Surrounding skin can appear rough or cracked, especially during colder months. Since thyroid dysfunction often contributes to overall skin dryness, the effects are frequently visible around the nails and fingertips. Muscle function in the hands may also be affected. Some individuals notice a reduction in grip strength or increased stiffness in their fingers. Tasks that require fine motor skills, such as buttoning clothing, writing, or opening jars, may feel more difficult than they once did. Although these changes are not always dramatic, they can gradually interfere with everyday activities. Perhaps one of the most surprising thyroid-related signs involves the voice. The thyroid gland is located in the neck, close to structures that influence speech. As thyroid function decreases, changes can occur that affect the quality and sound of the voice. Many people develop a voice that sounds deeper, hoarser, or less clear than before. They may find themselves frequently clearing their throat or feeling as though their voice lacks its usual strength. Friends and family members may notice the difference before the individual does. Several factors contribute to these vocal changes. Fluid retention can affect tissues surrounding the vocal cords, altering how they vibrate. Reduced muscle function and slowed tissue metabolism may also influence voice quality. The result is often a voice that sounds lower, rougher, or more fatigued. Some individuals notice that speaking for long periods becomes more tiring. Others find that their voice sounds normal early in the day but becomes hoarse after extended conversation. Public speakers, teachers, and professionals who rely heavily on their voices may become particularly aware of these changes. The neck itself can sometimes provide visible clues. In certain cases, enlargement of the thyroid gland may create fullness at the base of the neck. While not everyone with thyroid dysfunction develops this sign, changes in the appearance of the neck should never be ignored, especially when accompanied by other symptoms affecting the hands, nails, skin, or energy levels. When brittle nails, swollen fingers, persistent cold hands, reduced grip strength, and changes in voice quality begin appearing together, they often form a pattern that points toward an underlying issue rather than isolated problems. These visible clues can offer valuable insight into thyroid health and may appear long before many people recognize that a hormonal imbalance could be affecting multiple systems throughout the body. One of the biggest reasons thyroid disorders often go undiagnosed for extended periods is that the symptoms rarely appear in isolation. A person may notice dry skin and assume it is related to weather. They may experience fatigue and blame a demanding schedule. Weight gain may be attributed to aging, while hair thinning is dismissed as stress or genetics. Each sign seems manageable on its own, and because the symptoms develop gradually, the larger picture often remains hidden. The thyroid gland influences nearly every system in the body. When it begins to struggle, multiple areas are affected simultaneously. The challenge is that these effects do not always appear at the same time. Some symptoms may emerge months before others, creating a confusing collection of seemingly unrelated problems. A person may first notice changes in their appearance, their skin becomes drier than usual, their hair loses volume and shine, their eyebrows begin thinning near the outer edges. These changes may be subtle enough that they are only recognized when comparing recent photographs to older ones. Over time, additional clues may begin appearing. The face develops puffiness, particularly around the eyes. The complexion appears dull, the hands become colder, and the nails become more brittle. Because each symptom develops gradually, many people adjust to the changes without realizing how different they have become. At the same time, internal symptoms often begin to emerge. Energy levels decline. Daily tasks require more effort. Mental clarity becomes less reliable. Concentration may suffer, and simple activities that once felt easy can start feeling unusually demanding. What makes thyroid dysfunction particularly deceptive is that many of its symptoms are common in the general population. Millions of people experience fatigue, weight fluctuations, dry skin, or occasional brain fog. As a result, thyroid-related symptoms are often explained away or attributed to other causes. However, the situation changes when multiple signs begin appearing together. A single symptom may not reveal much, but a pattern often tells a different story. Dry skin combined with hair thinning, facial puffiness, unexplained weight gain, and constant fatigue creates a picture that deserves closer attention. Medical professionals frequently look for these patterns during evaluations. Rather than focusing on one symptom alone, they examine how multiple changes connect. The combination of visible and non-visible symptoms often provides valuable clues about what may be happening inside the body. Many individuals later diagnosed with thyroid dysfunction recall noticing several warning signs long before seeking medical advice. They may remember feeling colder than everyone else, struggling with persistent exhaustion, or wondering why their appearance seemed to be changing despite maintaining healthy habits. Looking back, they often realize that the signs had been present for years. Another important consideration is that symptom severity varies significantly from person to person. Some individuals experience only mild changes, while others develop more noticeable symptoms. Two people with similar thyroid hormone levels may have very different experiences. This variation can make thyroid disorders difficult to recognize without proper testing. Family history can also play a role. Certain thyroid conditions tend to occur more frequently within families. Individuals who have relatives with thyroid disease may be at increased risk and should pay close attention to patterns that suggest hormonal imbalance. Age can further complicate recognition. Many thyroid symptoms resemble changes commonly associated with aging. Fatigue, slower metabolism, dry skin, and reduced energy are often accepted as normal parts of getting older. This assumption can delay proper evaluation and treatment. The body has an extraordinary ability to communicate when something is not functioning properly. Visible signs often appear because the thyroid's influence extends throughout the skin, hair, nails, muscles, and facial tissues. Internal symptoms emerge because nearly every organ depends on thyroid hormones to regulate energy production and metabolic activity. When these clues begin appearing together rather than separately, they create a pattern that becomes increasingly difficult to ignore, offering valuable insight into the possibility that the thyroid may no longer be functioning at its optimal level.